We'll go ahead and get started now. So, welcome everyone. Appreciate you taking time out of your busy schedules to join us this afternoon for the Community Pharmacy More Profit Roundtable. This is the mini version. I do a full hour-long version once a month where we bring in products and new things for the pharmacy to sell. But we're going to focus today in the next 25 minutes on some amazing opportunities for community pharmacy around clinical services. That is what community pharmacies are interested in expanding into. It's not feasible to just dispense medications any longer. And so we are helping community pharmacies navigate the right way to expand into community health through clinical services and medical billing. And so I'm excited to be here. My name is Breck Rice. I have been a community pharmacy advocate for 22 years. I host the PBM Reform podcast on the Pharmacy Podcast Network and continue to try to make positive changes in helping lawmakers understand that the PBM and insurance mafia is really stacked against community pharmacy. So everything that I try to accomplish will be to help community pharmacies bypass the PBMs and make more profit. So a few months back, the Vice President of Sales and Marketing for Remote Care Today, George Veronis, who's the co-host today, he approached me about a fairly new program that's covered by Medicare called Remote Therapeutic Monitoring, and asked if it would be beneficial for community pharmacies. Well, after learning more about exactly what the program is, I was extremely excited to help bring it to community pharmacies because it is going to help you help your senior patient population in a way that you've never been able to help them before. It's an exciting opportunity to help those patients stay independent longer and help them with the two main things that they're concerned with, and that is memory or loss of memory, and then also loss of balance. So when we talk about clinical services, it goes well beyond just doing one service. It is fully credentialing to do medical billing, and there's more wrong ways to do this than right ways. So we wanted to outline that for you to do today as well. We are just going to touch on step 2 and step 3 here in the success process. The majority of the time will be focused on remote therapeutic monitoring. Main reason is there's no startup cost to that. There's zero capital investment for community pharmacies to start helping their patients with remote therapeutic monitoring, where step 2 has a small startup cost, and then step 3 has a much larger build out for a clinical room and everything. And we'll just touch on those two items just a little later. Like I said, we're going to spend the majority of the time talking about remote therapeutic monitoring from Remote Care Today. You can do 1 and 2 collectively, independently. You just can't do 3 without step 2. It's kind of a progression that's needed there. So wanted to turn some time over to George to tell you more about this amazing program called Remote Therapeutic Monitoring.
Well, did you have the other slide with the 3 buckets?
I do. We're going to get to that.
Yeah, okay, I'll go through
now?
this first. Well, let me go through. So RTM is, sorry, go back. RTM is kind of, yeah, go through this first, Breck, then I'll come to the other slide.
Okay. Yeah, so this is kind of a progression of what Medicare has covered over the years. Back in 2015, they started with chronic care management. 2019 is when remote physiological monitoring, or I've always called it remote patient monitoring, has come onto the scene. And then the newest kid on the block is this remote therapeutic monitoring, which just has been out for a couple of years. This is the first time that it's been offered to community pharmacies to participate through this new platform that George is going to tell you about. You can always expand your scope of services into the CCM RPM side, because those 3 buckets Remote Care Today helps with. The easiest one to start with, though, is our TM, Remote Therapeutic Monitoring, because the other 2 buckets require the primary care provider's involvement. It requires credentialing in certain ways, and we can certainly talk about that. But the easiest thing to get started is the remote therapeutic monitoring with the program that that George has.
Yeah, so first of all, thanks, Breck, for the introduction to the whole industry and the community pharmacies. And obviously, all our goal here, even at remote care today, is to help patients with two of the biggest issues I'll talk about, and also to bring more profit into the pharmacies. But RTM, before we show you a couple of videos, I'm going to show you a series of 3 or 4 videos for a few minutes, and it'll pretty much tell the whole story. But if you could look at this list, RTM is easy because there's almost every single senior will qualify for this program. I mean, what senior doesn't have muscle and joint issues, tendon issues, ligament issues, respiratory issues? Who doesn't do medication management? And if you look at the symptoms it covers, pain, stiffness, weakness, swelling, limited range of motion, numbness, lack of balance. Again, I don't think there's anybody over 64 or 65 that doesn't experience something of those symptoms. And then ultimately, the goal is with our program is to improve outcomes for them, improve cognitive issues, mobility, motion, balance, reducing falls, and pain relief. I will tell you, like my mom's 90 years old, still gets around, still drives. And our biggest fear all the time, she's supposed to use a cane. She rarely does. And we know if she falls, it's the beginning of the end in most cases. Go ahead, Brett. So
Yeah, I was just going to mention, George, I'm not a senior, but I qualify. I have pain and stiffness.
too bad that baldness doesn't but anyway, the two concerns we said is falling. So why does Medicare want to cover this and make this such a big part of their agenda? Well, look, leading cause of injury related to deaths for seniors is falling. 50 billion per year cost to healthcare last year. It's going up to $101 billion. Cognitive impairment is significant. Dementia, we all know, is increasing, and it actually increases if people fall, believe it or not. Loss of muscle and balance, and again, every second someone's falling. And then the additional problems we know is all the cognitive issues with dementia and Alzheimer's, and this program could absolutely delay that. And if you look, every 65 seconds, someone's diagnosed with that. So loss of savings and the quality of life is what every senior fears. I used to work down in the villages in Florida where there's hundreds of thousands of seniors. And when I would do this one medical program I was doing, those were always the two concerns. They knew someone that was good friends and now couldn't remember anything, and someone around the corner always fell. So let me show you a series of a couple of videos that explain our program. Brain health is the main one, and there's a 3 or 4 minute video that'll just outline everything for you. So go ahead, Brett.
America's independent pharmacies, 18,000 strong, are a pillar of thousands of our nation's communities. But it's no secret that many today are under financial stress and need to find new sources of revenue within their existing businesses. That's why we're happy to introduce you to our Brain Health Plus program that can provide tremendous benefits to your patients and significant new revenue and new profits for your business. Brain Health Plus, a remote therapeutic monitoring program, RTM, is backed by overwhelming scientific evidence, is covered by Medicare Part B and most Medicare Advantage plans, and can help prevent, treat, and often reverse musculoskeletal disorders, memory loss, cognitive regression, and loss of balance, thereby slowing decline while helping prevent falls and loss of independence. It can even reduce the risk of dementia by as much as 75%. Brain Health Plus, accessed on a smartphone, tablet, or computer, is the most robust, enjoyable, and engaging RTM platform available for your patients and can help them achieve amazing results as they'll look forward to the daily activities which are fun, engaging, diverse, and provide great feedback on improvements, all designed to improve balance, cognition, and respiratory functions. These exercises and games are so effective because it stimulates the cerebellum, which controls memory and balance. Rather than the same old day after day exercises some programs provide, Brain Health Plus has numerous exercises, games, and activities so patients never get bored. We also send a daily engaging email message encouraging patients to check out the quote of the day, fun history facts, and encouraging healthcare facts that motivate patients to be engaged in their own health. Our built-in medication management module includes daily reminders and potential drug-to-drug interactions. Your patient's smartphone also scans labels of both prescriptions and OTC products and feeds them right into the system, also providing out-of-date alerts. The platform also features geofencing alerts, where family members can be notified automatically when a loved one is at a hospital or ER, without requiring patient interaction. If admission was required, when it's time to go home, discharge papers can be photographed and integrated right into the system. And having this data readily available has resulted in a 50% reduction in 30-day hospital readmits. We also include engaging diagnoses and specific health education for patients to help keep them as healthy as possible. In addition to our Brain Health Plus platform, we also provide a revolutionary solution for patient engagement, an easy-to-use AI-powered 30-second biometric facial scan, which they can use at home with a smartphone or even a computer's built-in camera. Your patients can use it as often as they wish to track their health, help identify risks, and stay engaged in the Brain Health Plus program. With 96% accuracy and 98% repeatability, it can analyze metrics like heart rate, blood pressure, oxygen levels, health risks, and others. This is not a substitute for medical care, but it is an accurate way to identify symptoms that just might help your patient recognize the need for lifestyle changes or make healthier choices with diet and exercise. You can make Brain Health Plus available to your patients because we make it so easy, as we provide a turnkey solution without ever any cost to you. We take care of all Medicare billing under our platform provider's Medicare NPI. We also take care of all patient support, coaching, and encouragement. Introducing Brain Health Plus to your patients is also easy. We'll provide a landing page containing a video that shows them how much fun and how helpful the program can be, as well as educational and user testimonial videos. Then give them an opportunity to enroll right there. We'll also reach out by phone to assist with the enrollment process. Our turnkey Brain Health Plus program can have a major positive impact on your patients and your pharmacy's bottom line. Let's work together to get your pharmacy on board and your patients enrolled.
So you can see, back one, Brett. So you can see that the important thing to understand here is that, again, we do everything for you. It's seamless to you. We're going to help your patients. You can earn profit. And then you can see on the screen, there's actually 3 or 4 different programs that we have inside this platform that your seniors can do on a daily basis or every other day. They have to do a few times a month. So if they get bored with one, they could go to another one. And each one has an assessment so we can see their progress throughout it. But I'm going to just show you one of the platforms that we're using called LudaFit, and it's sponsored by us, but you'll see how powerful this program really is and what your patient, and then we'll hear from one senior that uses it so you can know that they will stay on this program month after month. So go ahead, Brett.
Exercise is a critical intervention, but seniors often struggle to maintain a routine. That's where LudoFit comes in. LudoFit turns exercise into an engaging and interactive experience. Seniors explore virtual destinations, from skiing in the Italian Alps to cycling the Tour de France, all while performing therapeutic exercises that improve balance, strength, coordination, and brain health. LudoFit is accessible for individuals with a range of mobility needs. It runs on any laptop or iPad and uses the webcam to track movements in real time. The program continuously adapts exercises based on each individual's needs and performance. All outcomes data is securely stored, giving users and their care providers meaningful insights to track progress over time. LudoFit isn't just fun, it's clinically proven, harnessing years of clinical development behind its sister product, Gentronics, a virtual rehab system used in over 500 centers and backed by 8 published clinical studies. The app has wide applicability across healthcare settings, from senior communities to home health to independent use at home. LudoFit is a solution that is as flexible as the needs of older adults. Scalable, clinically backed, and easy to use, LudoFit empowers individuals to stay active while supporting organizations in delivering better care.
So the other part of it is you got a pretty good idea, a lot of testimonials in that product. And then the key is we're going to do all the engagement for you. We're going to have scanners. We're going to have your QR code. We're going to have videos inside. We have posters, bag stuffers. And then inside, if we get the ability to text your patient base, we have a video built inside that says, from you, Hi, Dr. Jones. I evaluate this great program to help you in the two areas of falls and cognitive issues. I recommend you watch this video and enroll in this program. So we have different marketing that we're going to set up for you. You can be engaged as much as you want. And then we meet with the patients. If they qualify, we put them on the program. And you basically just have to spend a minute doing an assessment each month to see how you do it. So it's a unique platform. Nobody else has it. The way we enroll people, we have a high ratio compared to anybody else that does this. And of course, our goal is help you be successful with these patients. So the key is, what do you have to do? What is your part in it? And in 30 seconds, I'm going to show how simple this is. And if our goal is to help you get 100 patients, or more, that would be about $2,500 a month. And it might take you a couple hours. So Breck, show them exactly what they do, and then we'll wrap it up.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
So we figured out if that took you 2 hours a month on 100 patients, that's about $1,200 per hour to do a simple assessment. So once you meet with the consultant that showed it to you, they'll answer any other questions you have about the program. And then when you're ready to get started, here's how simple that process is.
To get started, your next steps are easy. First, complete our agreement and sign the BAA, which ensures HIPAA compliance, and then we'll schedule your onboarding meeting. During this meeting, we'll discuss how we engage patients and the materials we can print and provide you that help patients engage with us. We will then educate and onboard your patients using approved text messages, emails, and friendly phone calls, providing the patient the appropriate programs and coaching, all without any cost to you. Your pharmacy then has the option to provide monthly data reviews for each patient, which earns you monthly administrative service fees. Better patient health, new profit for your pharmacy, improved patient loyalty. Let's get started.
Good. So at the end of the day, you improve your patients, add revenue or really profit to your office. You complete turnkey system and no capital investment. So go ahead, Breck. You can wrap it up and then go into your part.
Yep. Yeah. So the next steps is just get with your care consultant that invited you here today to get the paperwork done. That'll include the business associate agreement or BAA. And that way all of your patient information is HIPAA protected. And again, they will help with the outreach, but through your pharmacy's communication system. So it's never a third party, and it's only what your pharmacy is comfortable with doing. You'll never have to engage with the patients in a way that you're not comfortable with. So if you want to just do all of the outreach yourself, that's great, with the signage and information, bag stuffers. They're even planning on printing the information on the outside of the prescription bags for you as well. But the most successful pharmacies setting this up are taking a two-prong approach: their own outreach from the store level, and then also having Remote Care Today help with that outreach. But again, it's through your own communication channels. So if you're doing SMS text reminders for refill pickups or prescription pickups and refill reminders, then that's the same system that they would use to also engage with your patients as well. So it's totally up to you. The last thing I want to cover is that so many pharmacies have been interested in the medical billing side. And I can assure you there are more wrong ways to do this than right ways. I've unfortunately had many pharmacy clients of mine unfortunately go down the path of spending thousands and thousands of dollars and still not get across the finish line. So this program here, IPPN, is the fastest growing community health collaboration in the country now, already in 18 states, working with a couple hundred pharmacies and several thousand physicians that are part of this. And it is helping fill care gaps that are missing right now, not taking the patient away from the primary care provider or the local doctors. It's actually, you become an extension to the local providers to help them fill those care gaps to get to services that they can't get to. So it's really a win-win-win. The patient wins because it's faster, better access to care at your pharmacy. The physician wins because they're still managing the care plan, so they still get compensated for that. And then the pharmacy is the big time winner because they are on average getting about 67% of all bill charges because of you're the place of service. Two things that are the lowest hanging fruit is if you're doing vaccinations, this will turn a $20 flu shot reimbursement into an $85 preventative health visit. The other low-hanging fruit for pharmacies is continuous glucose monitoring. If you have patients that are on continuous glucose monitors, once you're credentialed, you are eligible for a consultative fee. It's about $50 per patient per month. If you own the monitor and just lease it to the patient, that's $150 per month for that as well. So that is a whole separate demo that we would invite you to get information on if you're interested in expanding into clinical. But it does start with the remote therapeutic monitoring, or RTM, that has zero startup costs. The IPPN program does have some startup costs. It's a fraction of what everyone else was charging, but it does still have some startup costs. So the third step that I showed you at the beginning in your expanding into clinical services with remote therapeutic monitoring, then IPPN for credentialing. That third step is the BRIM wellness. That's not for every pharmacy. It does require a footprint of about a 10 by 12 foot space. Most states require that it has hand washing stations, so you've got to bring plumbing in. So it won't fit for every community pharmacy, but it is a wonderful program that you can build upon step 2 and have a full brick and mortar clinic that's not only managed for you, but is staffed for you as well. And that's called BRIM Wellness. And again, those are separate demos if you have interest. So at this time, we are done with the presentation and would like to open it up to our pharmacy partners who have joined first to ask any questions that you might have. Just simply come off of mute and we can answer those questions for you. Again, opening this up for our pharmacy partners first, and then if we have time at the end, any of the care consultants can also chime in with any questions you might have. Well, I'd like to thank everybody for coming out this afternoon. Appreciate your time and hearing about these wonderful services to help you better care for your patients, not just the senior patients, but then expanding into the credentialing with medical billing that expands into all payers as well as your senior population. But thank you for listening to the Community Pharmacy More Profit Roundtable.